I have experience, I suppose, both as somebody who prescribes the device and trains and educates people to use them, and then also as a family member. Well, our daughter was diagnosed when she was 16 months old, and at the time with diabetes. And at the time, the advice was to wake up at 2 a.m. and check her blood glucose using a meter. So we had to prick her finger, get enough blood out of her finger to get it on a test strip, get the reading, and then make a decision based on that number. And the reason for this advice is that under the age of 3, the brain is developing rapidly. What happens now when parents have a child who is diagnosed under the age of 2 is that child most often is wearing a continuous glucose monitor. And instead of getting up and waking the child up and pricking their finger and then waking the whole house up and then struggling to get back to sleep, what the parents or caregivers can do now is they can literally roll over, look at their phone, and have a reading right there in real time. I can't say enough about the benefits of CGM, and there are many. First of all, if you think about the real-time benefit, these are devices that can help people without much more engagement than turning on and looking at their phone or turning on and looking at a reader device to know their glucose level in real time and also the direction that their glucose is going. In the past, we had blood glucose meters where people who were very, very committed to their self-care maybe checked 10 to 15 times a day. Think of the game Connect the Dots. If you had 10 to 15 dots, you couldn't draw a very detailed picture. But with a CGM, when you get data every minute or every 5 minutes, you can literally draw a landscape. You can learn so much more about glycemic or blood glucose levels, how they're responding to food and exercise and stress and other factors. And as an individual living with diabetes or as a person on the care team, make really informed decisions about how to improve the approach to diabetes self-management. In some cases, it's turnkey. We can get a continuous glucose monitor prescribed and on that person at diagnosis. In other cases, there are a series of barriers. It might be out-of-pocket costs. It might be that it's not covered in a plan. It might be that there are a lot of sort of administrative steps that are fairly unclear into how to take them and which direction you need to go with that prescription, whether it's through a durable medical equipment company or through a pharmacy benefit. So when these barriers start to arise and they require action by both the diabetes care team and the individual who wants to benefit from using the CGM, the system can kind of break down. And the more these barriers exist, the more challenges we see, and the less likely it is that the person can benefit from CGM therapy.